Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today the topic which we have taken is endovascular treatment. And to discuss on this, we have with us in studio Dr. Rituparna Baruah, cardiologist from Apollo Hospital, and Dr. Pradeep Hatimota, radiologist from Matrix Diagnostic Center. So we have two doctors today, so we are hoping for a very fruitful discussion on the topic which we have taken. So not to waste any more time, I'll straight away move to the topic which we have taken today. All right. Thank you so much for coming, Dr. Pradeep and Dr. Rituparna, to Good Life, the health show. So a topic which we have taken is endovascular and treatment. So first of all, Dr. Rituparna, I would like to ask you about a general meaning, about a general understanding on the endovascular treatment. So what would be that to our viewers?
Yeah, to understand what is endovascular therapy or treatment. So what do you mean by endovascular? So for example, if we want to treat any disease that is involving suppose in the brain, and there are a lot of vessels in the brain. So the important is that whenever we access to the diseases, and we'll access that diseases through a vessel, and we actually make a small puncture in some vessels, most commonly in the groin vessels, because these vessels are bigger vessels, and then without any kind of surgical process, we go through these vessels and then access to that disease segment and like treat those diseases. So we call it as endovascular, means inside the vessel. That is what we mean endovascular. And we can, in common term, we can tell it's a pinhole kind of procedure.
Pinhole kind of procedure, because for viewers like us, and for me actually, like endovascular would be something to understand. So pin-like a procedure, that is a common term which viewer can understand. All right, if we come to you, Dr. Pradeep, is it a test or a therapy or both? What can we talk on this?
Yeah, endovascular procedure, initially it was used as a diagnostic procedure to diagnose the vascular problem. But mostly, as it is an invasive procedure, mostly the diagnostic role is played by the CT angiography or MR angiography. Endovascular procedures are commonly nowadays used for therapy only.
Okay. So for a therapy only, so this is basically used, so this is, we can say that it is basically used in all the hospitals and it is very much in these days?
Yeah, it is very much a part and parcel of this modern clinical practice.
Okay, so this is a part and parcel. So this is very important for our viewers to know that this has become a very much a part and parcel for any of the hospital or any of the doctors to treat the things, and the therapy is very effective as well. We'll come to that as well. So how's it differ from surgery, Rituparna? Like if we talk on that, like surgery and therapy. If we talk on this.
When we start about the definition, actually, we have discussed.
Absolutely.
Because there is no surgical cut and there won't be any scar. And then it is just a pinhole procedure. So we make just a small puncture with a needle and then we go through it. And the most important and most beneficial part of this procedure is that there will be no surgery and there will be no scar mark. And then the recovery time of the patients, all these diseases are very, very short. Most likely like 1 day or maybe 2 days, like that.
Okay, so a pin type surgery or whatever therapy you are talking about, so is it effective and is it okay to cure the disease which the person is suffering from?
Yes, these are extremely effective procedures. Extremely effective, and actually we can access any vessels in the human body, right from the brain to the toes, and we can treat any disease that involve right from the brain to the toes.
Now let's talk about some of the diseases. What modality can it help us? So what would be that?
Yeah, many diseases can be treated by endovascular means, like the vascular problem. Start from the brain. In the brain, you may have aneurysm. There is blister in the blood vessel that can rupture and lead to catastrophic bleed. That aneurysm can be coiled. That can be coiled by endovascular means, and it prevents the future bleed.
Okay.
Second thing is one more condition is called arteriovenous malformation. That can be treated by this procedure. And recently that stroke therapy, because the cardiovascular event, ischemic stroke is very common these days. So if the blood clot is in a major vessel in the brain, that can be taken out by endovascular therapy and patient recovery is fast.
Okay, so patient recovery is fast. So, like patients, when they come to hospital and when they hear about these kind of therapies, it's in general like they always think about operations. They always think of OT, and they have like less knowledge about this kind of therapy. So, do you always give a guidance to them? Do you always make them understand what kind of therapy this is, and this is going to be effective for the patient who have come to your hospital?
Yeah, first of all, see, many of the procedures, many of the patients, the surgery is not possible.
Okay.
So there is no question of surgery. Only mean to treat is endovascular way, because that patient is not fit for surgery, and that condition is not amendable for surgery. That patient can be only treated by endovascular procedures. And in some situations, it is combined procedure. We have to combine with surgery and endovascular therapy both.
Okay.
And in some condition, endovascular is the only way to go about.
Okay, so in some conditions, like this is only the method which can cure a patient. So that is, of course, clearly will be said by the doctor. Doctor, we have a phone call first. So let's take the phone call and then we'll proceed with the discussion. Hello.
Yeah, hello. মই আপোনালোকৰ প্ৰগ্ৰামটো চাই আছো। মই জানিব বিচাৰিছিলো এই যিটো টপিক আপোনালোকে লৈছে এই টপিকটোত হাইড্ৰোকেফালাছ বুলি যিটো বেমাৰ আছে তাতো ট্ৰিটমেন্ট কৰা হয় নেকি যিটো ব্ৰেইনত পানী জমা হয় বুলি কয়?
Okay.
No, hydrocephalus is a entirely different thing that can be only treated by surgery.
Okay.
There is no role of
it would be better if you can just answer the question in Assamese, the person will be
hydrocephalus patient bilak surgery is the only option. Surgery কৰি পেলাই যেটো মানে ব্ৰেইনৰ ভিতৰ যেটো পানী জমা হয় এই পানীখিনি ডাইভাৰ্ট কৰিব লাগিব এটো শান্ট সাৰ্জাৰি বুলি কয় এটো নিউৰোসাৰ্জনে কৰে এন্ডোভাস্কুলাৰ সাৰ্জাৰি থেৰাপি ইয়াত একো ৰোল নাই
All right, I'm sure the viewer who have just asked the question must be benefited. And if you have any doubts, you can always come and meet them and make your queries and ask your questions clearly, and you will get your answers as well. And we are here. Our numbers are flashed on your television screens. If you have any queries regarding the topic which we have taken today, please call up, and Dr. Rituparna and Dr. Pradeep is in our studio. Will give you all the answers as far as possible. All right, coming to you, Dr. Rituparna. So let's talk about these procedures. So can this procedure lead to the complete therapy or complete cure of the disease?
Yes, of course. And many of the diseases.
What are the chances if we talk about?
So if we can talk about chances, and then there is more than 95% of the cure rate. Because whenever we try to treat any kind of disease, and the selection, it matters. What kind of disease actually we want to treat.
Okay.
So we call it an indications. If our indication to treat the particular disease is extremely good and correct, then there is no chance that it might fail, and there is more than 95% success rate. And the complication rate of these procedures are rare, and it is not common. We can call it uncommon. And one very important thing before discussing the complication and other adverse effect of this procedure is that these procedures actually need technical requirements.
Technical requirements.
Yes. So the technical need is extremely necessary, because
and as we are upgrading with the technicalities these days, and we have a lot of like functional, like a lot of like equipments have been upgraded. So hospitals have been like awarded with that. So this is also one kind of positive note for the hospitals as well. Isn't
so
it?
we need a lot of equipments. Actually, most important is the cardiac catheterization lab.
Okay.
So whatever we do in this type of therapy, we do under the X-ray radiation, and then under X-ray we can visualize that particular vessels, and we go through that vessels and treat the disease. So the cardiac catheterization lab, where we can use different types of catheters, and we do these procedures under X-ray, and then we can visualize those vessels, and then we go through and treat these diseases. So the cardiac catheterization lab is very, very important. And also important is that the trained personnel or staff is very important, and
because they are going to play a very important role in this
so
procedure.
It is not a disease to be treated by only one person or one physician or one operator. So we are helped by many people. We call this technician, assistant. So it is a team effort.
Actually, it's a team work, and it's everybody's effort that makes the thing very easy. And this is one. So let's talk about some of the disease, doctor, like which has been treated by this procedure. So then also our viewers will have an idea that what kind of diseases we are talking about, which this procedure is going to help on.
Yeah, this procedure basically used for three purposes.
Three purposes.
One, if the patient is bleeding. Suppose there is a patient is having severe coughing of blood, that is called hemoptysis. If patient is having blood vomiting, that is called hematomesis. If patient is having bloody diarrhea, that means patient is bleeding from somewhere.
Okay.
We can occlude the artery by this endovascular therapy, then disease can be cured.
Okay.
Second thing, if there is artery is blocked.
Artery block.
Yeah, suppose it is in the carotid artery, that artery that supply the brain, that artery can get blocked, that can be reopened by angioplasty. And in case of peripheral artery disease, like lower limb arteries, if patient is diabetic, hypertensive, there is every chance of having occlusion of the lower limb arteries. So in that case also that arteries can be opened up by this procedure.
Okay.
And if you look, talk about the individual procedures, like I said, the brain, aneurysm, AVM, stroke, we can treat this endovascular procedure. In the chest, we can do the hemoptysis by blocking the bronchial arteries. In the abdomen, we can do the like hepatic artery aneurysm, gastrointestinal bleed, like patient is having hematomesis and melena. We can treat this patient and the angioplasty in case of lower. And the young hypertension, if patient is having renal artery stenosis, that can be or reopened by the angioplasty.
Okay, so this procedure, I would just like to have a like, clear in my confusion that this procedure, is it same for all the diseases or like it is different for different diseases? Like
it is different for different diseases.
Okay, okay.
Yeah.
Okay,
actually
so whenever...
Yeah, the common name is endovascular.
Okay.
And then actually for the common viewers, understanding of the common viewers, two type of disease in the vessel. Two vessels. So it could be either blocked or it could be either opened up or ruptured.
Okay.
So if it ruptures, so there will be a lot of bleeding. And if it is blocked, then it can cause ischemia because the tissues, these arteries supplying oxygen will be blocked. And because of that, the tissue will suffer from less of oxygen. So we call it ischemia.
Okay.
With the endovascular therapy, we can treat both the block and also for both the bleeding also.
Okay. So this is one kind of thing like people will have to have a clear notion about it and then only they can proceed with the thing. Okay.
And
with that, yes.
Tumors also.
Okay.
Like if in a female, if there is a uterine fibroid and patient is having heavy abnormal menstrual flow, patient is having severe pain during mens, those fibroid can be treated by endovascular embolization, that is called uterine artery embolization. And if there is a tumor in the liver that cannot be operated by surgeon due to so many causes, so that can be treated by tense arterial chemoembolization. Same procedure can be done in the renal tumors, lung tumor. Everywhere.
So in short, we can say that lot of like benefits are there from this endovascular treatment, and one just have to understand what exactly is this treatment. So doctor, we'll just slip into a short break, but do come back soon because viewers, we have lots more on the other side of the break. Welcome back, viewers. You're still watching a Good Life, the health show with me, Pooja, and we are having a fruitful discussion on endovascular treatment. And we have with us in studio Dr. Rituparna and Dr. Pradeep Hatimota. So let's move across to them and talk more. We have just got a mail in our official website, and the question that has been asked by one of our viewers have just asked that, is this treatment is being also effective for menstrual cramp, which you just mentioned?
Yeah.
So just in a gist, if you could just answer the question to the viewer.
See, menstrual cause can be due to so many causes. Like two more common conditions are uterine fibroid and adenomyosis. Both these conditions can be treated by endovascular therapy, that is uterine artery embolization. But if it is cramp is due to endometriosis, that is a different entity that cannot be treated by endovascular, means that has to go for surgeon to the gynecologist and operative procedure.
So better will be that when the patient comes to you and then you will be given a proper diagnosis, and then only things will be more clear that this treatment or this therapy is effective for this person or not.
Right. What is the underlying disease?
Absolutely.
Accordingly, you have to think.
All right, Dr. Rituparna, coming back to you, let's talk about this therapy. So is this procedure a life-saving? Can we say that?
Yes, this procedure can be life-saving. For example, if we talk about endovascular therapy, any problem in the vessels we are treating, we can call it endovascular.
Okay.
I am a cardiologist. So whenever the patient comes with heart attack, we treat the heart attack patient with endovascular procedure only. That is what we call is angioplasty.
Okay.
Like another patient, suppose there is block in the foot arteries and that's foot about to be amputated if it is not opened up. So with the process of this endovascular therapy, we can immediately or within a very short span of time, we can open up this vessel with some balloons and then we can place a stand there and we can re-establish the vascular flow in that particular vessel and saving the limb also. So this kind of surgery procedures are extremely life-saving. And another example I want to give, like gastrointestinal bleed. Patient is coming with GI bleed and then we can immediately check these abdominal vessels and if a major vessel is bleeding there, so we can immediately stop that bleeding with occluding that particular vessel. So it is definitely a life-saving procedure.
It is definitely a life-saving. So in common, suppose a patient has come to your hospital, what is the first thing, like what is the first procedure a hospital does with this kind of therapy or with this time? Of course, there will be a form fill up and then they will come to your hospital, then they will be having a proper checkup. So depending on the disease, depending on what kind of disease the person is suffering, then only you will be asking them for shifting to this kind of therapy or this. So what would be there? What is the first thing you do with the patient?
First thing, we have to evaluate the patient. We have to see the blood pressure, whether the patient is in shock.
That is
or
very
not.
much
then
important.
If patient is in shock, that has to be resuscitated. You know, his blood pressure needs to be under control by IV fluid or blood transfusion. Then next step is to investigate the patient. What is the cause of bleeding? When we get the found out the cause, then we can proceed with the endovascular therapy. So first thing is the clinical examination to assess the blood pressure and everything, to see whether the patient is stable or unstable. If patient is unstable, then he needs to be hemodynamically made stable. Then only we can proceed with that.
Now, if we talk about the benefits of this procedure, doctor, like what would be that for a general people to understand about it?
Most important thing is it is a pinhole, very minimally invasive procedure.
There is a
hospital stay is very minimum. You know, the patient can, if the patient is very sick, he is not fit for surgery, he is not fit for general anesthesia, those group of patients we can treat with this procedure because it is minimally invasive, no need of general anesthesia. So hospital stay is less and cost is, of course, it is
so lots of basic procedures and lots of basic facilities can be, and lots of basic benefits we can say that we have in this procedure.
Yeah, definitely. It is very,
so if any of the person who is suffering from any kind of a disease, then you should not come and think about it like what kind of like a therapy is this, because doctors like you are there to make them understand that this is not going to make you confused, but there are a lot of like research happening these days and people get a lot of research on internets, so that makes them a lot of confusion, isn't it?
Yeah, definitely.
Sure. I was just want to share this message is that selecting patient for the particular endovascular therapy is very, very important. We always emphasize on this indication of that particular therapy. This is very important. And initial clinical assessment and then followed by the clinical stabilization. If the patient is suffering any kind of bleeding disorders or cardiac problem, then stabilizing the patient and then ask the patient for going for this type of therapy is very, very important.
So who can perform this endovascular procedures? Like
endovascular procedures are performed by endovascular specialists. So to be an endovascular specialist, it needs special training. Special training, they should understand what is cardiac catheterization lab. They should understand, they should recognize different types of catheters and then wires and different types of gadgets like balloons and different types of stands. And also there is a steep learning curve of this particular therapy. And then a person at least need to do more than 100 cases that involving a particular disease. Because with the help of this therapy, we can treat any vascular problem that can be there in the human body. So it needs definite time to learn this process. Probably 3-4 years is definitely necessary. Probably Dr. Pradeep will be
3 years training is must.
3 years training is must. And it's a never-ending like study because like we learn every day because the technology is upgrading every day and things are coming up new. So you have to update yourself with all kind of like study. Isn't it?
Definitely. With conference, workshop, we regularly visit the conferences, workshop.
Do you also like organize any kind of like workshop to make aware about it? Because these kind of terms are very rarely heard and people have not much knowledge about it. So do you also, the hospitals nowadays organize a lot of like kind of workshops on many kind of like disease and many kind of therapies as well. So do hospitals...
we do organize the different kind of workshop and conferences for endovascular therapies, but those are basically for the doctors only.
For the doctors also, huh? For that make them understand and make them aware about the therapy, what has been upgraded at this to this time. So let's talk about like complications, doctor, like what kind of complications can this procedure, from this procedure can occur, if there is any complications?
See, it is procedures. In any vascular procedure, we use iodinated contrast.
Okay.
So first of all, patient may have contrast-related reaction.
Okay.
That may be mild.
At first.
Mostly it is mild. Patient may have allergy or
So those precautionary measures, do you always
we always
them?
take the precautionary measures. So we give steroid and anti-allergic medicine to prevent the allergic complication. Second thing, it is a pinhole procedure. So we puncture the artery. That can cause to local hematoma. Patient may have small amount of blood clot at that area.
Okay.
So that is the second. Third thing is that we advance with the catheter and guide wire. Very rarely the patient may have dissection of the arteries. So these are the complications, but very rare.
Very rare. So all those precautions and all those things, what has to be done after the therapy and what has to be done before the therapy is always guided to the patient, isn't it?
We are very careful actually while doing these procedures. The most important is that whenever we take the access, so we are very careful and take a very clean puncture, pinhole puncture, and then through that puncture we very slowly and carefully we just proceed forward to do this all this type of therapy.
Absolutely, because it's an important role for the doctors as well, but it's also an important role for the patients as well to listen to their doctors, what kind of treatment or what kind of like precautionary measures have been given to them, to follow them correctly, to take the medicines on time, and what has to be done, what has not to be done. So these things has to be taken a note of it. Okay, we are talking about the technical requirements needed for this procedure. So what would be that, the doctor?
We actually mentioned a few of these technical requirements. Most important is the cardiac catheterization lab, and this is important, and they followed by different types of catheters and balloons and wires. So for different diseases there will be different balloons and the catheters and wires. So there are varieties of gadgets required, and then to know and understand each of these gadgets, it needs time.
It needs time actually.
Yes. So it is a learning process.
This is just like we are getting a note of it, like what exactly is happening. This is, I'm not sure, this is nothing to do with the patient, but they should also have a knowledge that what we are talking about, the equipments, what are the upgraded equipment, so that they will have a clear picture about the thing which we are talking on. All right, so let's talk about the admission procedure. As you have already mentioned that it's like you don't have to stay long in hospitals. Let's talk about that.
So many of the procedure we can do, it is a daycare basis. That means patient come in the morning, procedure is done, then patient can be discharged.
And no one loves to stay in hospital for a long time.
Like one disease we treat by radiofrequency ablation of varicose vein. Patient is having big vein in the legs that are prominent. You can see the veins are all big veins, tortuous. It is very discomfortable, visible, and it is a discomfortable things for the patient. So that can be treated by endovascular means that is called radiofrequency ablation. So for that procedure, patient can come in the morning time, patient get admitted, then by evening he can be discharged. And by like uterine fibroid embolization also in the other in the foreign countries, they do is a daycare procedure. But to take the precaution because patient may have some kind of pain, some amount of pain. So we do the patient admitted in the day, the same day procedure is done, and next day we discharge the patient. So most of the patient by second day.
By second day, depending on the procedure and depending on the patient condition. Condition of the patient is very important to judge on, like is that patient is fit to go home or he or she has to stay for another 1 or 2 days. So that has to be like acquired and that has to be talked about. And so when the attendants come to you, they have a lot of questions in their mind, isn't it? They have a lot of questions, and when these kind of therapy is done, so they have a lot of questions. So how important is to handle them, and like how difficult is to handle them? I'm sure you must have gone through your...
Most important is the communication.
And
you need to give time to them. And they also should give time to us also, so that we can communicate well. And it's very important to draw certain kind of diseases and the treatment process and by drawings. So, and that can probably help in communications.
Absolutely. Doctor, we are really short of time. So on last note, what would you like to tell our viewers? I would like you to tell first and then you.
There are several viewers should understand that there is a alternative procedure that is called endovascular therapy that is there to replace surgery. Many of the disease we can treat with these minimally invasive procedures. And all our viewers should be aware of these procedures, and so that they can go to the doctors and talk about the endovascular therapies as an alternative procedure.
Okay, Dr. Rituparna?
Yeah, it's a very important pinhole procedure, and then when there will be no surgical scar, and the hospital stay is very, very short, and most of the procedures can be done as daycare method, and then the cost of the therapy is not very high. We can treat this patient with reasonable cost, and then probably all the vascular disease right from the brain to the toes can be treated with this procedure.
All right. Thank you so much, both of you. Thank you so much, Dr. Rituparna and Dr. Pradeep, for coming to our show. And with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.